So going to just get on with some cases basically, because I once went to a thyroid talk and they didn't show any images, so I was really disappointed. So I'm going to show loads of images. I'll just try and get through as many as I can, we've got the most of them, we've got the cytological and histological correlation. So there is some paper around. If people want to write things down, that's fine. If you don't want to write anything down, you just want to look, that's fine. But we'll hopefully get through maybe 10 cases or so, and then look at what they turned out to be. So 42-year-old female, right thyroid lump. So this is actually a surgical trainee. She was actually presenting with a different lump, but then we noticed this little thing here. So give it a U classification. Yeah. Okay. And then so it would get an FNA. So we'll come back to that case later. So case, if you're writing this down, that's fine. Case 2, an incidental thyroid nodule on an MR spine. So again, think how you would give this a U classification. I think the U classifications are actually very similar between the UK guidelines and the EU ones. So I think they would completely overlap for all these cases. So there's the other view, longitudinal view, right lobe of thyroid. And I do put colour on. I know we were saying we don't put it, but I do put it on for everything. So there is the colour Doppler. So that's case number 2. Case 3, just simply said goiter, 23-year-old female. So I think you'll appreciate on that view, top left, that the thyroid does look bulky. So one of the questions you have to ask yourself, are there any nodules? And if there aren't, then what's going on? So again, just have a think. If you were reporting this ultrasound, what would your report say? Would you give any U values? If so, what would they be? So case 4 was a palpable neck swelling. So this is the right lobe of the thyroid there. You've got the trachea there, carotid there. So this is the lesion in question. So how would you grade this one? What U value would you give it? There we go. And then case 5, it's actually this nodule here that wanted to look at. So how would you grade that? Benign or malignant? Would you want to put a needle in it or not? Case 6, in fact, I'm going quick, maybe I'll get through them all. Just wanted to show you lots of pictures. So case 6, this is a larger nodule here. How old was I haven't put the age of the patient there. So what grade would you give this? Which U grade? And would you put a needle in or not is really the crux of it. So there's some vascularity there as well. And you can see there peeping in the edge, there are further nodules adjacent that look very similar. So query palpable thyroid, borderline blood tests. So trachea, so this is the left lobe and the right lobe here. So some kind of differential there between the left and right lobe. And then this was the right lobe, I think. And so it's this nodule that we're grading. So we've seen quite a few nodules that look like this already. What grade would we give that? Would we put a needle in it? Fairly vascular. Okay, next lesion. So this is case number 8. What grade would we give this? So hopefully straightforward. Case number 9. So this is left lobe of thyroid here, trachea's there. So this is the lesion in question. What grade would we give this? So think of what U grade you would give. And there is the other view. So it's 1.16 millimeters, fairly well defined. Case 10. So this is the trachea here. So we're kind of right side of the isthmus, border of the right lobe there. So again, what U grade would we give that? Okay, and showing the comet tail artifact there that we've seen a couple of times already today. So what U grade would you give this nodule? And we were talking about calcification here. So you can, although it is rim calcified, you can see within it. So it's hypoechoic and looks solid. And then we could demonstrate some internal vascularity. So again, it's alive. It's soft tissue, vascularized soft tissue in there. So a bit tricky though, because it's a bit contradictory which U value. But we have the pathological correlation. This is the contralateral lobe of the same patient to this one. So there's some small nodules here. So what would we call these? What U value would we give those? I think I'll skip through a couple because we've seen things that look like this already. So case 15, not the clearest picture, but it's this nodule here that we're interrogating. So this is the border of the thyroid gland here, and this is the strap muscle here. And then, so what and there is some echogenic, there's an echogenic area here. So what U grade would we give this, and would we like to stick a needle in? Another picture of it there. A bit amorphous. And vascularity. So this is a patient chest radiograph. So the patient has enlarging neck swelling and a hoarse voice. So you can see just on the plain film there is a big neck swelling up here. So it's definitely big. And then on ultrasound, something that big, you're going to really be interrogating and characterizing the superficial aspect. The deeper aspects are going to be tricky to see on something that big. So a couple of cystic spaces. What U grade would we put a needle? I think probably anything that massive, you just get scared by the size of it. So yes, we would put a needle in whatever the ultrasound shows when they're that huge sometimes. And that's the CT. So it does look like a soft tissue, huge soft tissue mass pushing the whole larynx over to the left. Okay, so classic appearance here that Vena showed. So what U grading would you give this nodule? Again, seen a couple of things like that. I'll skip through that one. Okay, this one has a pattern that we've not discussed today, but yeah, we'll discuss it with the histology. But what grading would you give that, and what would you put? Would you put a needle in that one? So case 20, this nodule is the one in question. It has a cystic cleft, but quite irregular in the centre, some vascularity, and then echogenic foci. So what U grading would we FNA? And that's the CT that goes, plain film again, trachea deviated to the left there, and the CT scan shows you can see calcification on the CT as well. Okay, interesting one here. So patient presenting with a goiter, and this is the appearance on the ultrasound. So trachea here, and this is the anterior border. We're over the isthmus here. So there's this extra soft tissue here. What grade would we give it? Would we FNA it? And that was a lymph node there in the left supraclavicular fossa. Ooh. Okay, what U value would you give this one? Then we have all on the same patient. So this is the right lobe. We want a U value. This is the left side of the isthmus up here. U value, would you FNA? And this is the lower pole of the left lobe here. U value to FNA or not? I think I'll show you the last one, then we'll go through what the histology showed. So this was just presenting as a neck lump. So difficult this one. It's got benign mixed features really. So I think in doubt in this kind of scenario, the best thing is to go err on the side of caution and FNA if you're in doubt. That's a bit of a tricky one. Right. Okay, and this is quite a classical sort of appearance here. So right lobe and then the left lobe, as you can see, is enlarged here. How would you U-grade this if you are going to U-grade it, and would you FNA it? Or what do you think the diagnosis is? That's fine, right. So this one, the FNA cytology, so it's echogenic foci calcification. It doesn't look like colloid artifact. It's quite small. She actually had on neck dissection, she had positive tiny micrometastases, and the histology is a papillary thyroid carcinoma. And she was young, so 42. She came with a separate benign thyroid lump, as is the way, but we found this small thing that she didn't know was there. Case 2. So this is an interesting one. So did anyone any thoughts what this is or what thigh? Borderline. Okay. Equivocal. Yeah. So morphologically, it's a U4, isn't it? But when you put the colour Doppler on, no matter how high you whack it up, there's no colour in. This was in my early days of embarking on FNAs, and I did put a needle in, but I probably wouldn't nowadays. So this is that's a hemorrhagic nodule. So it's just benign and hemorrhagic, but because it's got the hemorrhagic material, it looks a little bit worrying, but actually it's not. And you'll get a Thy1C or a Thy1 for your cytology, unfortunately. But they ended up having a right hemithyroidectomy because it was quite a large lump on a slim neck. So this one, Graves' thyrotoxicosis, very vascular there. So no nodules, but diffuse thyroid disease. This one was an infected benign cyst on a hemithyroidectomy. This one, I can't remember why this patient had a hemithyroidectomy, but they did. Anyway, this is the typical appearance of a colloid cyst. You might get some hemorrhage, it involutes, and it densely calcifies. So when you see something very densely calcified like that, I would call that benign. I wouldn't bother FNAing it. And if you do, you'll get Thy1 than Thy1 because your needle can't penetrate it. So this one was actually benign. The cytology was Thy2. I would call this a U3. Would everyone agree? So U3, Thy2, right hemithyroidectomy was colloid nodules. She had quite a big neck swelling on the right. So this one was a thing that looked like an egg or a testicle there, and that was background Hashimoto's thyroiditis, and this was a hyperplastic benign nodule that contained a 3 millimeter focus of papillary microcarcinoma. So you can't see the 3 millimeter focus of cancer. It's just come out, incidentally. So that was the whole nodule itself is benign, but with a tiny focus of malignancy. So what U grade did we give this? U2, yeah, it's just a cyst. It's not a trap.
What? And a cyst on the walls of the cyst on the left-hand side of the picture, is that just a deformed cyst wall, or is it just when you look at it, it's not sort of entirely locked? So
no, this is just a simple cyst. You mean this wall down here?
The one on the left-hand.
Oh, here.
Yeah.
I think that's a little bit of artifact. I don't think that's real, actually. Ultrasound's a bit of witchcraft, You can take a picture, it can look a bit odd in some respects. So no, I don't think that's a real thing. I think it's just a plain, simple cyst. So this one, hypoechoic, so I'd call this a U4, probably. Some people might call it a U5. This came back as Thy3A, then Thy3F. And the left hemithyroidectomy was a follicular adenoma, so benign. And that's the other view of it. This one is actually, you'd call it a U5 probably, but this came back as a non-Hodgkin's lymphoma in the thyroid. So that is a lymphoma on the hemithyroidectomy. Often look like that, hypoechoic. And there was background Hashimoto's on the contralateral lobe. This is just a benign colloid cyst, so no needles required. This one was, this was the calcified one, but hypoechoic within. This was a Thy5 total thyroidectomy, showed a follicular variant of papillary carcinoma. And those nodules on the left, because they had a completion left hemi, they were just colloid nodules, so nothing to stress about there. Small, but spongiform looking. I think I skipped through this one, but that's just a benign follicular adenoma. This is just a benign colloid goiter, this one. So they look very similar. There's so much overlap. This one, so what I was trying to show here is this is actually invading the strap muscles and extending outside the thyroid, and there's calcification. So that was a 2.5 centimeter papillary thyroid carcinoma. This was a large nodule that came back as a follicular carcinoma, this one. So again, nothing really much to differentiate it on ultrasound from the benign things that we've seen, but probably a large U3 there, so follicular carcinoma. This is just a spongiform bog standard U2, but they ended up having a hemi for some reason, and it was all benign colloid goiter. So U2, spongiform. I think we skipped through that one. That one was benign. This one's nodular Hashimoto, so they talk about a giraffe skin pattern. This is my example, but there's better ones on the internet. So giraffe skin nodule, benign Hashimoto's nodule, quite vascular. This was papillary thyroid carcinoma, so it's got calcification, a bit shaggy looking centrally. And this one was a squamous cell carcinoma that was invading into the thyroid, presenting as a goiter from the post-cricoid region there. So you can see it's invading into the thyroid. So that one's just a colloid nodule, U2. Spongiform nodule here. I wouldn't put a needle in that. And then this one, I would call that a U3 or 4, probably. I think it's an older patient, so I called it U3. And that was a benign follicular adenoma. So U4, probably, strictly speaking, for that. So they were all benign. I think I skipped through that one. This one, actually, with the large cystic space, turned out to be a papillary carcinoma. So a bit tricky, that one. I've changed my practice a bit around cysts after seeing that one. And this one, again, was a lymphoma of the left side of the thyroid. And that's the end. Thank you very much.